Hey everybody, it's Dr. Trey with the Trans Trainer, where I provide physical therapy, post-op programming, and fitness coaching to other queer and trans individuals. Today, I wanted to do a little demo on how we work on scars as a physical therapist and how you or your partner could do so for you at home after top surgery, hysterectomy, phalloplasty. It doesn't really matter what procedure. This can be used on any type of scar. So I'm going to be demonstrating on my top surgery scars, and I'm using just some vitamin E cream. It doesn't really matter what kind. You don't need anything scented or anything super expensive. I got this on Amazon for like $5. So biggest thing to note is the difference between an incision and a scar. We don't want to start working on incisions, okay? Incisions are when they're still bloody or scabbed, versus a scar is when it's sealed already. So it depends on the person and how their healing goes. Sometimes we can start this as early as like 2 weeks out. Sometimes it needs to be closer to 3 or 4 weeks. It really depends on the person. So what we want to do is when your scars start to look closed, okay? What we want to start doing is taking a little bit of vitamin E or some kind of plain lotion, coconut oil works, and just take 2 fingers and get a little bit on your fingers. We don't need to slather it up, okay? And what I usually do first is I approach the scar parallel to the incision. So what I mean by that is my top surgery scars, they run horizontally. So what I'm gonna do is put my fingers on either side of the scar and work horizontally to the incision. And why we do this first is that we're going to make sure that we don't gap that scar open and we don't start to make it bleed, especially if it's really fresh. You can add a little bit of pressure here. We don't need to baby it, but I'm also not going super vigorously up and down vertically over the brand new incision. Okay, so I'm going more horizontally parallel to it, and I'm going to go all the way across. Now, yes, this is something you can do yourself. However, if you're early on, for example, after top surgery, my other side is also affected. So it's hard to tolerate kind of reaching your arm across and then pushing pretty hard. So early on, you might need a friend or a loved one to help you, which is totally fine. And you can show them this video and they can help you do it. So I'm just going to be working parallel to the incision. Spend a minute or two doing this, every day when you get out of the shower, for example. It doesn't need to be, a 20-minute thing. The other important thing to note is that scar tissue seeks out other scar tissue, almost like a magnet. So if you're somebody that has had free nipple grafts like I have, a lot of times there will actually be a scar bridge that forms between your nipple and the incision line. So make sure you really work in this area between the nipple and the incision, because that will get to be a really thick kind of bridge of scar tissue. The other spot I find gets really scarred down is, depending on how far your incisions go, in the armpit, which again is kind of hard to lift your arm up and reach all the way over, so you may need some help. Now, after you've done the horizontal work parallel to the incision for a few days, and we can tell that it's really starting to heal up, it's definitely a scar, not an incision, then we can start to get a little more aggressive. So I'm going to now take my 2 fingers and I kind of keep them together, and I'm going to start making circles, right? Clockwise, counterclockwise, up and down, diagonal, side to side. Because if I look at my skin anywhere else, my skin moves all directions. So that same thing should be on your scar as well. So if you notice areas where it's not moving, where we can tell that that skin is not sliding around, that's an area you really need to work on. So you can get pretty aggressive in here, so I'm just using a couple fingers and making circles. You can actually do that on the nipple graft, but again, you have to wait till that heals a little bit. This is probably closer to a month out for most folks. But every day, I would do this around 6 months after your procedure, like every day for 6 months. And it makes a huge difference not only in how the scars look aesthetically, but how functional you can be. Because if that scar tissue scars down to your muscle underneath, it makes it really hard to gain range of motion back in your shoulders and to resume your normal activities. So I hope this was useful. And if there's any other questions y'all have from a physical therapist who's been through these procedures, hit me up and I would love to help answer some questions on post-op recovery. All right, thank you.